Hi again. For those of you who haven't seen my other two videos, my name is Kat. I work with Dr. Wright. He is my lipedema surgeon. I have stage 3 lipedema, and I have seen him now for 2 out of 5 surgeries. So I'm almost halfway through my treatment process, and my most recent surgery was on my upper legs on the back side. I had previously already gotten my upper legs on the front side treated with tumescent liposuction. So, after the surgery, you are still leaking a lot of fluid. They use this tumescent liquid that numbs you, and that fluid um, is leaking for me. It was about a week, and so you're bruised and in a bit of pain. You're wearing your compression leggings, and then you're wearing padding to catch any of the fluid. I personally stayed home for 2 weeks after my second surgery. I tried to rush back to work after a few days post first surgery, and that was a huge mistake. Dr. Wright will laugh when he hears that because I just was stubborn and thought I could get right back to it. So I do recommend taking at least a week. For me too was so much better to get your bearings and get through the bruising and all of the drainage. Um, Really after that, it was all about slowly getting active again. I do a lot of weight training, and recently I started taking up boxing again, just at home. I put on a boxing videos. I have a boxing bag, and that helps me get my cardio in. But the weight training is really, really what helps me start to see the difference pre, treatment and post. That that stubborn, bulgy fat is mostly gone, and I can actually see some muscles developing, which um, those of you with lipedema know it's impossible nearly to see any progress, even if it's there under all of that fat. So I'm back to a really active routine. Um, Overall, between the surgeries, I've lost about 45 pounds. I'm now fluctuating up and down about 5 pounds. So I'm trying to see if I can gain some muscle, which is fine with me, or continue losing on my own as I get ready for my third surgery, which will be on my calves. So stay tuned for that. As always, check out lipedema.net if you're interested in talking to Dr. Wright, or if you just want to check out his free resources. The blog also has tons of topics that I find really helpful. And then obviously the surgical versus non-surgical treatment options really can help you out as you're trying to decide on your path forward. Feel free to reach out to me on Instagram at kat.carwick. If you have any personal questions, I'm always here to help. And I'll talk to you soon.